Coronaviruses are a large family of viruses which may cause illness in animals and humans. In humans, several coronaviruses are known to cause respiratory infection, ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). The most recently discovered coronaviruses causes coronavirus disease COVID-19. COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This new virus and diseases were known before the outbreak in Wuhan, China in December 20. The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat, or diarrhea. Those symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell. Most people, about 80%, recover from the diseases without special treatments. Around 1 out of every 6 people who get COVID-19 become seriously ill and develop difficulties in breathing. Older people and those with underlying medical problems like high blood pressure, heart problem, or diabetes are more likely to develop serious illness. People with fever, cough, and difficulties in breathing should seek the attention of the medical doctor. Who can catch COVID-19 from others who have the virus? The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching those objects or surfaces, then touch their eyes, nose, or mouth. People can also catch COVID-19 if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. This is why it is important to stay more than 1 meter, that is 3 feet away from the person who is sick. Clean your hand with an alcohol-based hand rub or wash them with soap and water for at least 20 seconds. Washing your hand with soap and water or using alcohol-based hand rub kills viruses that may be on your hand. Maintain at least 1 meter, which is 3 feet between yourself and anybody coughing or sneezing. When someone coughs or sneezes, they spray small liquid droplets from their nose or mouth, which may contain the virus. If you are too close to the person, you can breathe in the droplets, including the COVID-19 virus. That is, if the person coughing or sneezing has the virus. Avoid touching your eyes, nose, and mouth. Hand touch many surfaces and can pick up viruses. Once contaminated, hand can transfer the virus to your eyes, nose, and mouth. From there, the virus can enter your body and make you sick. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth and nose with a bent elbow or using a tissue when you cough or sneeze. And remember to dispose the used tissue immediately. Droplets spread virus. By following good respiratory hygiene, you protect the people around you from viruses such as COVID-19. Stay home if you feel unwell. If you have fever, cough, and difficulties in breathing, seek medical attention and call in advance. Follow the direction of your local health authority. National and local authorities will have the most up-to-date information on the situation in your area. Calling in advance will allow your healthcare provider to quickly direct you to the right health facility. This will protect you and help prevent spread of the virus and other infections. Keep up to date on the latest COVID-19 hotspots, that is cities or local areas where COVID-19 is spreading widely. If possible, avoid traveling to places, especially if you are an older person or have diabetes, heart or lungs diseases. You have a higher chance of catching COVID-19 in one of those areas.